Brisbane since last 4 years, and we are tied up almost nearing 500 eyes. So consultant to Carl's Eyes India. So I think you might have heard Dr. Sri Ganesh was talking in the morning about what exactly we do in this treatment. Just to, for a few people, for those who are not attended that session. So this treatment is for presbyopia correction exclusively by Zeiss. So it's a combination of micromonovision and increased depth of focus. Of course, Dan Renston is the person who invented this technique. So what exactly we do? So we make the dominant eye emmetropic and make the non-dominant eye myopic by 1.5 diopters. But I just want to tell you the blend zone is nothing but where the vision from the both from the dominant and the non-dominant eye meets up, and the binocularity retains. So as I already said that we make them dominant eye emmetropic and non-dominant eye myopic by 1.5 diopters. But how exactly we do the increased depth of focus? This is with the help of creating a controlled spherical aberration in both the corneas, means both the dominant and non-dominant eyes. So most of the time actually we induce a negative spherical aberration. How much the spherical aberration we induce, I think probably a company never give that secret, but up to 0.5 diopters of spherical aberration you can induce in each cornea. So coming to the little bit, I just want to tell very important thing is refraction and dominant eye testing. In my hospital, in spite of having a lot of optometrists, I do normally the refraction for this patient is very important, and try to see for dominant eye testing. Of course, you need to, I think I will not be explaining, I think everybody knows how to do for this dominant eye testing. Followed by, once you know the dominant eye testing, your job to do the micromonovision testing. So how will you do the micromonovision testing after knowing the dominant eye? And then non-dominant eye, you add 1.5 diopters, then open both the eyes, you tell the patient to see for distance, whether the patient can see for distance and near vision. And some of the patients really complain of cross blur. So these are the patients you need to repeat this test. If you repeat for 3 times, 4 times, 5 times, 6 times, still the patient complains of cross blur, I think these are the patients I never counsel them for presbyopia. So I just tell them that you don't go for this particular technique. And one or two couple of times, since it's a discussion, one of the couple of times patients tend to immediately change their dominant eye from, if they tell that the right eye, immediately they tell the left eye is dominant. So you need to be a little bit careful. So that's why, being a ophthalmologist, I always do my patients, especially those who are very much interested to go for this treatment, I only check for dominant eye testing, then followed by micromonovision testing. Then we need to explain to the patient that see, this is the vision you are going to get after the treatment, and so you need not have to compare each and both the eyes, and you need not have to close the one eye from the other eye. So the treatment is routine, I think LASIK treatment, and the routine pre-LASIK evaluation, what and all you are doing pre-LASIK evaluation you need to do, and with the help of special software CRS Master, by using either MEL 80 or MEL 90. So of course you can see here, normally the software has got to do with the 1.5 diopters, but we have been doing it for the patients from 37 years till I think 52 years. Especially in 37 years, we are little bit reducing from 1.5 to either 1.25 or plus 1 diopters. And if the patient is around 48 to 50 years, we increase up to plus 1.75. So we are not increased, but why can't we increase to 2? Because if we increase to 2, patient may lose the binocularity. So coming to the new software that come nowadays, I don't think so. They are giving with the laser blended vision software. Now they are coming with the newer Presburn software, the advantage, it has got the ability to consider preoperative spherical aberration of the eye. You can do a customization. Also, there is a greater flexibility of optical zone while planning for treatment, and even you can include the functional age. So, of course, coming to the commercial aspect, how is a good presbyopic treatment going to affect your practice? It's very important. Even companies looking at this perspective. See, I think most of them, I think, are presbyopic patient. Even the patients with the LASIK who are undergoing for LASIK treatment, the parents are very much interested to get rid of their glasses. And most of the even immature presbyopics also wants to get rid of their glasses. Even already, like the patient might have already undergone for IOL surgery, pseudophakic patient, they are also interested to get rid of their glasses. So, especially see LASIK interested myopic patient after the age of 36 may not be happy with the conventional distant vision correction only. It may worsen their near vision symptoms. So, these are the ideal patients to counsel them for presbyon. So, as I already said that most of the present generation presbyopic population are very busy professional. Of course, most of them doesn't want to wear the glasses. Almost the main thing is they are looking for what is the alternate treatment. So, coming to the other modalities of treatment available in the market, especially I just want to touch upon that presby LASIK. Actually, what they do in presby LASIK, the disadvantage with this treatment, which is associated with blurred vision for distance, at least 3 months, and most of the patients who had come to me, actually, some of the patients from this area might have been treated in elsewhere. They had come to us with a loss of distant vision by one line. Of course, they take up to 3 months for contrast to develop, and even for need for repeated treatment. They tell the patient that you need to do the repeat treatment after 3 to 4 years. And of course, I do a lot of multifocals, especially patients with cataract, multifocal, trifocal. But you all know these problems with these IOLs, because especially having the patient complaining of halos, glare, and also night driving problems. Of course, very important, decreased contrast sensitivity, and especially very sensitive to skill or unpredictability in outcomes. So, who is suitable for presbyon? Almost one over age of 36 may be a candidate. And the one good thing about this treatment, myopia up to -8 diopters you can do. Even hypermetropia you can do up to 5.75. But in my hospital, we have done hypermetropia up to +3 diopters and cylindrical power up to 3 diopters. So, widest range of refractive error compared to any other presbyopic LASIK treatment. The important in this treatment is which is pupil size independent. So, presbyon make your patient care complete, especially catering your presbyopic patient. Those who are interested in LASIK, very important to tell about post-cataract refractive error, giving every monofocal IOL patient enjoy to glass-free life. So, as the advantage, probably Dr. Sri Ganesh was telling, I think he himself got operated a couple of months back, Sheetal also here. More than 95% of the patient adapt so fast, and maximum a period of 2 months, and other treatment may take more than 3 months. Especially I am talking about the wow factor in presbyon. You need to see immediate clear distance vision, excellent immediate, intermediate and near vision. One of the fastest treatment to adapt. Of course, important to see that no immediate blur, no halos, no night driving problems, no significant effect on the contrast. Your patient can get back to their routine in no time. You will be the popular no time too. So these are our little experience. I think these are the 150 patients come for more than 6 months or more follow-up. Actually, myopia of around 95, hypermetropia 39, emmetropia 16. So what you can see, none of our patient lost more than a half a line as far as the distant vision is concerned. This is very, very important. And probably I will not be touching upon anything about the pre-op. You can ask me the questions, I can get back to you, whatever the doubts regarding this treatment. Probably the best and safest presbyopic treatment available till date, will make your patient happy, will keep you happy also, will bring you more business, will make your hospital popular. Thank you.